I grew up in East Tennessee, in the Appalachian Mountains, where there's lots of good outdoor activities. My father was a biochemistry professor. My mom was an English teacher, so I had lots of good help with school. I think the independence that I gained growing up there with my love of the outdoors led me to join the Boy Scouts, where I eventually became an Eagle Scout. I left East Tennessee and went to school in California at Stanford University, where I majored in human biology. And that really drove me to pursue a career in medicine. I came closer to home to Vanderbilt in Nashville for medical school and stayed there for my surgical residency. While I was in residency at Vanderbilt, I met my wife, Kim, in the doctor's lounge at Vanderbilt. I was there with another orthopedic resident, and she was telling us about all of the really cool outdoor activities she had done in medical school. She was into rock climbing and some other really cool stuff, and I was very impressed with her, but I got called away and didn't have a chance to ask her out. I saw her again a week or so later in the emergency room and didn't pass up the opportunity. And fortunately, she said yes, and we went on several dates and got married during our residency. We finished at the same time in 2003, and she matched into a cardiology fellowship at Emory, which brought us to Atlanta and to Decatur. I joined DeKalb Surgical Associates and have been in practice here ever since then. Kim, when she finished her fellowship at Emory, went and took a job at Northside Hospital, and our practice has opened an office there since then, so occasionally I get to spend a romantic lunch with her in the doctor's lounge. We also have two children, Bella, who's 9 years old now, and enjoys rock climbing and soccer, and also other outdoor activities. And our son Brooks, who's 11, who is a big baseball player at Murphy Candler Park and likes mountain biking. One of the nice things about being in DeKalb Surgical Associates is having really good, competent, caring partners who can help take care of patients when we're out doing family activities or away from the office. I think one of the things that's always been important to me is family. Growing up, I had a strong family. We have a great family now with my wife, our two children. And when a patient comes to our office, I try to treat them the way I would want my family treated. We sit down, talk about the disease process, whatever's going on, and what the surgery would be, in a way that I think my family members would want to hear. I think a lot of people think of general surgeons or surgeons as being very type A personality, yelling in the operating room, throwing instruments, and particularly in our practice, that's really not the case. There's four very level-headed guys just wanting to provide good patient care and to work as a team to get the job done.